But I don't worry about myself. I tend to worry about my son and his generation. I feel like we have a responsibility to protect them from harm. It's really our responsibility and the government's responsibility so that we as parents and consumers don't have to worry about when we buy something whether or not it's toxic to us. So we always ate a lot of canned foods, and we'd make canned sweet potato muffins and just use canned beans. So I think BPA first came to my attention, he was probably about 2 years old. I was upset because we'd been using canned products, and I didn't really have a heightened level of awareness of BPA until he was already out of his infancy and early childhood. So I felt like I'd been so good during pregnancy with being organic and watching what I was doing, and just knowing as much as I do as a physician and a mother. But then to realize that I'd kind of missed the 8 ball on a pretty important topic like bisphenol A with its implications for hormonal disruption. And anyway, I still get kind of upset thinking about it. And then a couple years later, I realized that one of the major reusable sports can companies had not been disclosing that they were using bisphenol A in their linings. So his first little reusable metal sports bottle was from that company, and he had already used it, and I had already gotten a new one because it was used to death. So that upset me also. I think to me bisphenol A is sort of a clarion call. It's like the top of the iceberg. We have more and more evidence that it's producing harm, and we need to take this step and be a leader and get it banned out of at least products that young children are exposed to. I'm pretty realistic. As a physician, I know about a lot of things that can go wrong in the development of a child. But when you're talking about the subtle effects from hormones, they're so complicated. The synergistic effects between chemicals in the environment and the growth of a child neurologically, reproductively, can be so sensitive to the effects of those chemicals. So, I just worry if he ever has any reproductive problems, or if he ever develops a cancer, God forbid. I try not to think about those things, but if anything like that would ever happen to him, I would definitely think back to his early years and the things that I was not able to control that he was exposed to. And that's just not right to be a parent and have to worry about things like that. But on a public health, if you look across the population, I worry about the effects on his peers and his generation and the people he grows up with. So if any of his friends ever get something bad, I'm going to worry about what they were exposed to when they were younger. So with paperwork and insurance hassles and having to see, a patient every 10 minutes, not even having time to deal with their direct medical problems, but to think about the psychosocial context of a patient's health is really hard to do the way our healthcare system is set up right now. The Carboy, or is that what they're called? The water dispensers that Kaiser uses in all their offices, or the hard number 7. So, and they're old. So I'm like, I don't know. I'm assuming bisphenol A is still leaching from them. Yeah, at my son's childcare, some of those little water containers are number 7s, so we've been trying to switch them out. Even our childcare still uses a lot of canned products. When you're talking about environmental toxins and bisphenol A, it's, I believe as a professional and as a parent, the onus should be on the companies and on the government to protect us from exposures to those chemicals in the first place. So there definitely needs to be policy, upstream to protect people so that when they make those choices to buy toys, plastic toys for their children, that they don't contain things that they're going to mouth and ingest like bisphenol A. So it really should be done at a higher level so people don't have to have a heightened level of concern and fear about things. And education can only go so far. It really has to be an upstream approach to protect people. So, I know more than most people, and I still wish I didn't have to think about it so hard, whether or not I'm getting something that's going to be toxic to my son. So it's really not fair. And it's because it acts at the hormone level, it's more subtle and synergistic. So to get the type of cause and effect studies that people like to see in toxicology, they would take years, because most of the effects, if you're exposed in childhood, you're not anticipating hormonal or cancers for years, decades down the road. First of all, Oregon would not be the first, so there are several other states, to my understanding, that have been working on or already have banned bisphenol A in certain products, especially related to children. People look to Oregon for innovation and to lead the way in changes, so it has to start somewhere. I mean, I moved here from the Midwest, so Oregon has that appeal of being healthier, but we have to live up to that reputation, I think. I mean, we need a ban now to protect our children's health in the future. I mean, it's just abhorrent that we're exposing a whole generation of children when we know now that this chemical, there's enough data to show that it should be off the market. And if we don't do anything looking back, it's our fault, really. So if it's labeled number 7, it could potentially have bisphenol A in it. If it's a hard, clear plastic and it kind of has a dinging sound when you ding it, then it might have bisphenol A in it. It's really not that easy overall, though. I mean, the CDC has done studies, and most of us have bisphenol A in our urine when it's tested because it's so ubiquitous in the environment. So you can be aware and look for it, but it's pretty much invisible. You can't see it, so you just have to have a heightened awareness of it. Yeah.